So I think Bowdoin Street Health Center is an oasis for people, a place where they can really come to heal. We have basic health services. They're very important to what we do. We have medicine, pediatrics, family practice. We have specialty services like OBGYN and mental health. And we work in partnership with people who live and work in this community on the issues that matter most to them.
Like the gang violence in the community. Those, you think about war-torn countries when you think about trauma like that, watching people get shot. But this is happening in the United States, in urban America.
The effect on the family is catastrophic.
I can tell you that I have about 4 parents who lost children within the past 2 years or so through violence.
I mean, there's some people who've had 2 children murdered. So it's kind of amazing to consider what is in that person that can keep them going.
Some people will talk a mile a minute. Other people will just sit there and silently weep. Other people will ask questions, the why me or why us.
I remember there were staff here who were doing home visits, particularly mental health staff were going out to these families and making sure that they were safe, that they felt safe, that they had someone to talk to.
I think they were losing hope. And then because of the center, hope came alive again.
We're able to take care of people who are impacted by the violence.
And the response of each family member is going to be different. And so we need a huge team, really, to help out with all of the possibilities of where this trauma can lead for this person.
Sometimes we see children that are just not growing very well or aren't developing the way they should. So those things tell you that something is not right. And it's our job to then try to find out what's causing those things to occur. It might involve the social service staff, it might involve the outreach staff, but it often involves many people in the health center.
We work as a team, which includes primary care, nurses, patient assistants, all of whom can find that their patient is suddenly showing signs of depression or anxiety or stress, which is very, very common in this neighborhood in particular, from community violence or just living day to day without the right support systems in place.
They come here not only for medical issues, they come here for anything because we are a community health center. They come here, for instance, where do I go to look for a job? Where do I go to learn English? Where do I go to find financial assistance, to find help?
I think the most challenging cases are always the domestic violence cases, especially when there are children involved. Most of my cases in domestic violence are in regards to women who are parents themselves, and they're just young parents. So they're between, the adolescent ages of probably 15 to 22, and they're the ones experiencing violence. And it's always really hard when you have someone who is still young themselves.
This woman that came from Trinidad, she come from the islands. Well, like I wanted to save her. If I could have taken her home, I would have. Feeling sad, feeling scared for wanting to get her to a safe place. When a woman comes into my office, I make her aware that, she doesn't deserve what's going on in her life.
They don't look at just your physical ailments, why you're feeling sick, why you keep getting sick, but they're asking other questions. And they start piecing it together because you're a whole. They want to work. They want to work with you as a whole person. I had to make a serious choice. And I had to get out.
So we can't save everybody, but we do save at least 1 or 2 folks on a daily basis.
I have a life back. And there's something to be said for that when you have peace and tranquility and sanity. And I think that they got me started on that road.
Bowdoin Street Health Center is licensed under Beth Deaconess Medical Center, and it's a wonderful partnership because we share a common value of taking care of anyone who presents at our door and doing that in a way where we provide the highest quality care for everyone.
How have your sugars been?
We're seeing great strides in helping patients, for example, who are diabetics, to improve their clinical health indicators, but also help to take care of themselves so they don't get sicker.
Support each other. The group supports each other.
And so that members of their family never get the disease. This is a great neighborhood. There are people who live in this neighborhood who are hardworking, who have lived here for many, many years, who care deeply about their neighbors and the quality of life in this community.
So the Bowdoin Health Center reaches out to all of the community. We had a walking program, and then we have the health fair. The farmers come and they bring their fresh vegetables, and we get all of the families out.
One of the things that we need to do is we need to create a wellness center in the health center that will enable people to learn how to cook healthier foods. We'll have cooking demonstrations and a demonstration kitchen. We want to have a studio where people can actually exercise, where we don't have to move chairs and tables around in our conference room. These kinds of infrastructure changes in the community go a long way to us being able to help people who are at risk of getting sick to not get sick.
It's like the center of the community, you know, that where people can go and they can gather, see people and meet people and have discussions, and they can have health services. And without the health center here, I think this community would be like without any life, without any meaning.
I find it very difficult sometimes to hear the level of pain and suffering. I've sat in on healing sessions that we've had. I've heard women talk about losing their sons. I've heard them talk about not being able to reach their children.
We know we're not the parents of the children that come in, but we're concerned in doing whatever we can to make their lives successful. Life isn't fair, we know that, but we have a hard time telling a little munchkin that life isn't fair. We try to make it fair.
I've heard people say we can come together through love, through hope, through faith, that we can make a difference. And there's this strength that people have inside that moves me every time I hear it to continue to do this work, because I know that we're helping them to tap that strength and to make a difference.